Hey all, to finish up the central nervous system here, we can't leave out the spinal cord. So, short little video here to focus on just the spinal cord. I love this graphic because I think it really illustrates the continuity of the spinal cord. I think it also does a nice job of showing how it is that these roots are going to percolate through the different protective layers, the meninges. Don't forget a key distinction between the brain and the spinal cord in terms of those protective layers is that between the vertebrae and that dura mater, you have that adipose tissue, the epidural space, and that's not something that's present between the skull and the dura mater. So bear that in mind as well. With the spinal cord, it's highly organized. So we actually see functionality that parallels a two-way highway. So this graphic is useful in illustrating that in some sections of the spinal cord, you're going to have ascending tracts. Recall that a tract is or collection of axons in the central nervous system. And then some of these axons are going to be myelinated and some are not going to be myelinated, but it is going to be white matter that we see throughout this region. And I'll address the gray matter or the butterfly shape in a moment here. And then the descending tracts are going to be going down very different pathways. But this organization allows for afferent inputs to go up from the body, senses to the brain, as well as motor output, other autonomic functions to go down these descending nerve tracts. So with the spinal cord, so sensory as well as motor information is going to be passed through the spinal cord. The organization, we define the different segments based on the number of the vertebrae as well as the letter. So C1, C2, C3, just as we saw with the vertebrae, those terms are going to correspond with the spinal cord, except you're going to have one extra coming up the top of C1. But it's going to begin right at the foramen magnum, right? And then going down to about L1 or L2. That surprises a lot of people, the fact that our spinal cord ends not too much below our rib cage, right? You've seen this picture before. I included it in another video, but I wanted to illustrate the fact that the reason a lumbar puncture is given in that lumbar region is nothing specific to our back, but it is because the spinal cord is going to end around L1 or L2. So if you come in with a lumbar puncture or spinal tap, and at around L3, then you don't have to worry about damaging the spinal cord at all. You will, however, be puncturing the meninges, and so you have to make sure that that hole seals. Otherwise, you can actually have a loss of pressure that may be felt in the brain. That cerebral spinal fluid can leak to some extent. A spinal tap may be given to assess for something like meningitis and administer drugs for cancer treatments. So there's a variety of reasons why somebody may need a lumbar puncture. So given that the spinal cord officially ends around L1 or L2, there is a continuation of what's called the quada equina. So you see nerve roots continuing on down past the spinal cord. So equina meaning horse, cauda meaning tail. So it really resembles a horse's tail as we continue past L1 or L2. So here we're looking at the organization in a little bit more detail. So you see the dura mater, the pia mater, you see some of the blood supply coming through here. But in addition, we're starting to take a closer look at the organization of the white columns and the gray matter. So the gray matter in the case of the spinal cord is going to be at the center. So it is this really butterfly-shaped structure here. This is all gray matter. So you're going to have horns. So this is going to be the dorsal horn, the lateral horn, and the ventral horn. Okay, and then looking at the white columns, we refer to these as funiculi, plural, or funiculus for singular. And we have a similar, so dorsal, lateral, and ventral funiculi. And these are all those white columns that I was showing in that previous picture as well. In addition, you see the central canal here. Now, students oftentimes have a tendency to believe that blood goes through the central canal, but it's cerebral spinal fluid. And remember that CSF is continuous from the ventricles in the brain all the way down through that CSF. In this picture, you're also seeing spinal nerves. So you're going to have all of these pairs of spinal nerves that are really part of your peripheral nervous system. So they're extending out of the central nervous system technically here. So they are going to be part of the peripheral nervous system. One thing to bear in mind is that sensory information always travels through the dorsal side of the spinal cord. And so, an important feature that you're seeing here are these dorsal root ganglions. So, nuclei are collections of cell bodies in the central nervous system. And recall that those ganglion are collections of cell bodies in the peripheral nervous system. So, even though we are dealing with the central nervous system essentially here, because these ganglion, because these roots do lie outside of the spinal cord, that's why we term them ganglion. But coming back to this idea of sensory versus motor, what we see, because this is a dorsal root, is we see that these are really the cell bodies of sensory neurons. That's going to become relevant again when we look at reflexes. I will save that for another chapter, but we will see that same pattern holding where sensory input comes in dorsal, motor output comes out belly side or ventral. Here is that the sensory nuclei, similarly as to what I was just describing, are also going to be oriented on the dorsal side. So here you have somatic sensory to the body, visceral sensory nuclei, so collections of cell bodies carrying information about our visceral organs would pass through here, or rather gather, congregate here. And then on the motor side of things, again, going to be on that the ventral side. Now, I intentionally included this graphic because it uses the terms posterior and anterior instead of dorsal and ventral. I want you to appreciate that those terms are interchangeable. You see them both used, and I think it gives you just a better appreciation for some of the different vocabulary that can be used here. You'll note, and also on your study guide, but on the posterior side, you have a median sulcus. But then on the ventral side, we have what's called the anterior or ventral median fissure. So it's not a sulcus, but a fissure. Fissures are much deeper, and sulci are more superficial. So again, if you think about the gyri and sulci, the bumps and grooves on the surface of the cortex, those sulci are the indentations, but they're not incredibly deep. Whereas the fissures that we have in the brain are going to be significantly deeper and more dramatic. Wanted to embed histological image here as well. So again, dorsal and ventral. Sometimes it can be flipped when you look at a slide. One way to tell them apart is the ventral side tends to be wider. So I think that is a wider letter, if you will. And so this is going to be ventral horn. This is going to be dorsal horn. And if you follow this around, this is your dorsal root ganglion. And you have the corresponding pair over here. And a ganglion, again, collection of cell bodies. So if we were to zoom in on this, you would actually see very clearly cell bodies. It's a beautiful structure. I posted some other slides so you all could really take a good look at a dorsal root ganglion and what that looks like. And again, the dorsal median sulcus as opposed to the ventral median fissure. When talking about the spinal cord, questions around spinal cord injury often come up. So while this graphic is oversimplified, it's not quite as cut and dry as this image would imply. It, in general, is the case that if somebody has damage in the cervical region, that they're going to have both a loss of movement as well as a loss of sensation to all four of the limbs. Whereas if the injury is between T1, so the first thoracic vertebrae and the first lumbar vertebrae, that tends to result in paraplegia, so where you just have a loss of sensation and movement to the lower half of the body. So I'm going to end the video here in terms of focusing on the spinal cord, and next up we'll look at the peripheral nervous system. Thanks, guys.